Hey, this is Nancy, one of the care queens. And you know, the people who are at the bedside all the time doing the hands-on care are our aides and CNAs. And you know, they write back to me on YouTube after they've watched our videos, and they have such great tips that I haven't even thought of because they're the ones that are doing this all the time. I had a CNA who's been in the business since 2014 write an incredible email to me with many of her tips. And I'm going to share those with you now. And many of them you may know already. And if you've got any more that I don't mention, please write in because we want to share this information so our patients get the most gentle and compassionate care. So I've got some notes here. I'm going to be looking down to make sure I don't miss anything. First of all, in our video on how to change a brief, which by the way has gotten over 4 million views, we forgot to say, lift the bed up so that you don't hurt your back. And we didn't lift it up because we needed a camera angle so you could really see the process. So that's why the bed is not lifted. And then, you know, we didn't say always wipe from front to back. And so those are a couple things that good caregivers always find when they watch our video, and they write in, and it's great. They're really paying attention. Okay, here we go with a few tips. That would be, one of the first things is to use shaving cream or no foam cleanser when a patient has really sticky bowel movements. And another thing that I've used before and really works, Brenda did a video on this, is to fill a squeeze or spray bottle with nice warm soapy water. First of all, you put a plastic garbage can, liner and a sheet and a towel. Get that under the patient, roll them back and forth. And then you can really squeeze that nice warm water and really get a perfect cleanse that will really get into all the crevices. It also feels so good to the patient. One of the things that I really liked that the caregiver said is, the patients need to be brought in so that they can cooperate. Make sure that they're part of the process. They understand why you're doing this. And sometimes you have patients that are bedbound. They need their brief checked every 2 to 4 hours. And it can be really annoying for a patient and uncomfortable if they don't understand why you're doing it. So she said, bring the patient in, help them be on the team, make sure that they know that you're going to be coming in to do that. Now, if a patient is really painful, of course, you're going to ask your hospice team or what their medication is for comfort and pain medication so you can pre-medicate them. And also for those patients who have Alzheimer's or have cognitive decline with dementia, agitation, they push against you when you're trying for care. Really pay attention to the medication that helps that patient be calm during the process. She also emphasized that if you see any skin changes, let your hospice team know right away. And I'm a hospice nurse, and I love doing patient care with the caregivers so they know I understand how important it is. And so I tell CNAs, schedule an appointment with me so that we can do this together. 4 hands, so much easier, better for the patient, really helps them be more comfortable. And the caregivers understand that those of us who are the professionals still need to, we value them. We value their work. And it's really important to have eyes on to see what those changes in the skin look like so that we can prescribe some treatment. The last thing I'm going to mention is that she says, patients have a right to refuse care. And if they do refuse a brief change or a check, that's fine. Let them know that you'll come back later. And when you do, if it's somebody that's a little cognitively off, you may say, it's time for me to check your brief, rather than, is it okay I check your brief? Be the grown-up in the room, let them know it's time and you would like to do it now. If they still refuse, again, that is their prerogative. You need to get your supervisor involved and document that any way your caregiving agency requires you to document it so that you can make sure that people understand that you're doing your job. I love this email from this caregiver. She was so succinct and clear. If you've got more tips, send them our way and we'll get them out there so everybody can be helped. And remember, we're the Care Queens, the Hospice Care Queens. Keep watching our videos. Thanks very much and have a great day.